Hi, I'm Mary Pat Olson, Director of the Healthcare Workforce Institute at the Metropolitan Chicago Healthcare Council, also known as MCHC. MCHC has been chosen to be your school's industry partner in the Illinois Innovation Talent Project, and I'm here today to tell you more about us and what our challenge to you will be in this project. MCHC is an association for hospitals and healthcare organizations, and we've been around since 1935. An association means that we work together with local hospitals and other healthcare organizations to collectively tackle problems in the healthcare industry. We are always striving to improve the delivery of health services by helping hospitals better care for the people in their communities. One problem that affects all hospitals and communities is the need to vaccinate babies, children, teenagers, and adults. We encourage people to get vaccinated and to vaccinate their children so that they're able to build up immunity to certain illnesses. This is why we also call it immunization. Common immunizations for babies and children protect against hepatitis, influenza, also known as the flu, measles, mumps, chickenpox, and many more illnesses. As teenagers, another set of immunizations for human papillomavirus, flu, and tetanus, among others, are recommended. In adulthood, annual influenza vaccinations are also recommended. When people go without getting themselves or their children vaccinated, it creates a risk of developing an otherwise preventable condition. MCHC's challenge to you is to determine the rates of immunization among babies, children, and teenagers, and to find out why immunization rates may be low in some areas. Once you understand why people are not getting vaccinated, then you will be able to come up with solutions to increase those rates. Before you begin, it will be important to understand the history of certain illnesses and how they led to the creation of vaccines. Lisa Johnson from MCHC's Clinical Services Department is going to tell you about two widespread conditions from the past, smallpox and polio.
Hi, my name is Lisa Johnson, and I work in MCHC's Clinical Services Department. Past discoveries in the area of vaccinations have laid the foundation for what we know today about how immunization can prevent certain diseases. In one instance, a disease has been completely wiped out because of the major efforts to vaccinate at-risk populations. Smallpox was a disease that was first reported in the United States in the 16th and 17th centuries. Smallpox is a contagious, disfiguring, and often deadly disease caused by the variola virus, and it results in a terrible skin rash and blisters with other symptoms such as backache, delirium, diarrhea, and excessive bleeding. At that time, it was considered as deadly as cancer or heart disease today. In fact, among children, it accounted for 1 in 3 of all deaths. Which is why, in 1796, a doctor by the name of Edward Jenner developed the theory that anyone who had been exposed to a much milder condition known as cowpox would then not be susceptible to the virus that caused smallpox. After some risky tests on his gardener's son and others, his theory was confirmed. Following a few years of further research, Jenner published his results, and in 1843, the United States began to require smallpox vaccinations. Other countries conducted mass vaccinations as well, and through these major efforts over many years, smallpox was announced to be eradicated in 1980. Another widespread illness that affected the U.S. in large numbers was polio. Polio is a contagious viral illness that in its most severe form causes paralysis, difficulty breathing, and sometimes death. In the United States, the 1952 polio epidemic became the worst outbreak in the nation's history. Of nearly 58,000 cases reported that year, 3,145 died, and over 21,000 were left with mild to disabling paralysis. During that time, a medical researcher from New York named Dr. Jonas Salk, with the support of the National Foundation for Infantile Paralysis, developed what they believed to be a vaccine against polio. The vaccine was tested in field trials that involved an astounding 20,000 physicians and public health officers, 64,000 school personnel, and 220,000 volunteers. Nearly 2 million school children took part in the trial, which found the vaccine to be effective And in 1955, it was announced that Salk had developed the first successful polio vaccine. When the news of the vaccine's success was made public, Salk was hailed as a miracle worker, and the day was celebrated like a national holiday. In the 2 years before the vaccine was widely available, the average number of polio cases in the U.S. was more than 45,000. By 1962, that number had dropped to 910, and in the U.S., the last case of wild polio occurred in 1979. Unfortunately, despite a global eradication campaign, wild polio virus continues to affect children and adults in Afghanistan, India, Nigeria, and Pakistan to this day.
My name is Miguel Razo, and as a nurse I understand how important it is to take what we've learned from the smallpox and polio outbreaks and apply it to our world today. Vaccinations are proven to combat preventable illnesses, such as the flu or measles, and because of this, the American Academy of Pediatrics has created a recommended immunization schedule that includes every suggested immunization from birth to age 18. In fact, you've probably been vaccinated for many, if not all, of the conditions on this schedule. Once someone receives an immunization, it goes into their vaccination record at the doctor's office. In 2009, one strain of influenza became headline news. The international outbreak of H1N1 was so widespread that the U.S. had declared a public health emergency that only recently expired in June of 2010. During that time, the Illinois Poison Center assisted the Illinois Department of Public Health by taking phone calls regarding this outbreak right here in the Illinois Poison Center call room. Many people called in to inquire about the availability of a vaccine against H1N1. However, the supply was very limited because it takes approximately 3 to 6 months to create a vaccine against a specific flu strain. So before the vaccine became widely available, the virus had time to take its toll on our country. The U.S. Centers for Disease Control and Prevention estimate that from April 2009 to April 2010, as many as 89 million cases of H1N1 occurred in the United States. Of those, 403,000 ended in hospitalization, and it's believed that 18,300 people died as a result. This flu season, a vaccine against H1N1 is included as part of the routine flu shot given throughout the country. Similar to polio and smallpox, now that a vaccine has been developed to combat this virus, the number of people affected will fall sharply compared to the previous year. H1N1 and the broader influenza vaccine is one immunization that affects your life today. Other vaccinations that high school-aged teenagers are recommended to receive are against human papillomavirus and meningitis. To learn more about what the Centers for Disease Control and Prevention, as well as the American Academy of Pediatrics, recommends regarding vaccinations, please visit the following websites.
Hi, I'm Colleen, and I also work for MCHC, and I'd first like to congratulate you on being selected to participate in this exciting project. Now you know more about the history of vaccinations and how they can prevent certain illnesses. I know you will do a great job responding to our challenge on how to determine immunization rates and to find out why they're low in some groups. Once you understand why people are not getting vaccinated, then you'll be able to come up with solutions to increase those rates. Remember, when people go without getting themselves or their children vaccinated, it creates a risk of developing an otherwise preventable condition. We here at MCHC can't wait to see and hear what you can find out about this problem and to learn about the solutions you will suggest for our hospitals and other healthcare providers. So good luck and thank you for your help.